Okay, we're here with Shelby May, and she's the program director of CNA, right?
Yes.
Okay, if somebody doesn't know, what CNA stand for?
So CNA stands for Certified Nursing Assistant.
Okay, what is a nursing assistant? Once again, if somebody doesn't know.
A CNA works alongside mainly the nurse, but other allied health professionals doing direct patient care. So the CNA would be the one to assist the patient to get dressed in the morning, to bathe, to eat if they need assistance with eating, to brush their teeth and those types of things to help them get out of bed and to walk down the halls and so forth. So really direct patient care.
Okay, and would we see these in hospitals or other places besides hospitals?
We would see them in hospitals, in long-term care facilities, in rehab facilities as well. So CNAs work in a lot of different healthcare facilities.
Okay, and in the program at Parkland, what kind of commitment are we looking at? Is it a 2-year program or?
It's actually just one semester. So it's just one semester, 16 weeks, and it's a pretty full 16 weeks. The student is in theory for that, but we also are in lab. We do lab skills. Where the student learns a lab skill and practices it, and then we go to clinical after that, where the student actually works with patients and practices those lab skills with patients.
Okay, and what kind of students kind of excel at this?
Well, students that really are kind of self-motivated, independent, but they also have to be kind of caring and compassionate. They have to have that kind of spirit as well, where they're putting the patient's needs before their own. And one also, we see a lot of students who want to go into nursing or maybe even other fields like physical therapy or other therapies. So this is a lot of times seen as a stepping stone to other healthcare careers as well.
Okay, and what we always ask, what kind of pay scale are we looking at for these people when they first start?
The range is typically around 11 to 12 to start, but it can go up to around 16 to 17 per hour.
Okay, and let's talk a little more. You said like this to start, but then this may be where a lot of people start. This is a good way to get your foot in the door, I'm guessing, and then maybe take some classes on the side, or how do people usually do that?
Yeah, so if they want to go into another health career, a lot of times they start with the CNA. For example, we have sections of high school students who are looking at nursing, for example, or other healthcare fields as a career. So they get their CNA in high school and they can work as a CNA and get some experience in healthcare, and then they can really know if that's what they want to do as a career. And oftentimes those students do go into other health careers.
I would think too, we talked about what makes you good at certain things, but I guess every situation, every day is probably different. What is a typical day like for a CNA?
So a typical day would be you get your patient list, so you work with different types of patients or residents, and they all have varying abilities. So you might have a patient or a resident who you need to do everything with, so that patient really can't do anything themselves, so you would be completely responsible for their care. But there are other patients who can be very independent, and so they just need a little bit of assistance with their activities of daily living, so that you might just assist that patient a little bit. But you would help them with their morning care, maybe help get them to their meals, help them to ambulate and their mobility skills as well, and work alongside nurses and therapists to take care of those patients' needs.
That sounds great, and I know Parkland has a really good rate of job placement.
Yes.
I assume this program's probably about the same?
Yes, there's always a need for CNAs, and that's really the great thing about it. You can go here in the community and get a job very quickly as a CNA, but you can also go out anywhere you want to go and work as a CNA, because there's just always a need for CNAs, so it's a great field.
Do they have to take any kind of licensing tests or anything like that, or?
Yes, a state exam is required, and so once they're done with the program, they sit for their state exam, and once they're certified, then they don't have to take another exam. But if they go out of state, they might have to sit for another state's state exam as well.
Okay, and last question. I'm sure you're out in the community a lot, and you see students you used to have.
Yeah.
What's it like when you see these students and you know they're doing well, and to know that you had a part in that?
Oh, I think it's great. You know, I see students. I was in clinical just last week, and I saw 2 students that were my CNA students that are now RNs, and they've been working in the field for a few years now, and so that's wonderful to see. That's what we love to see, students being successful, doing what they love. So it's a great feeling.
Okay, now we're in the dental hygiene lab with Program Director Peg Boyce. Hello, welcome. Thank you for doing this. I'm looking around. This is a lot of chairs and stuff. How many students do you have in your program?
We take 36 students each year, and so we have over 70 students in the program because it's a 2-year program.
Okay, so I'm assuming it's like the rest of health professions. If you graduate, you pretty much get a job, right?
Yes, and after the pandemic, there have been a lot of jobs available. It's a good career. People stay in dental hygiene for their whole life. Jobs are there.
What kind of things do they do? I mean, I know most people think, oh, well, it's just, you know, you get your teeth cleaned.
Right.
But there's probably a little more to it than that, isn't there? What kind of things do they do in their job?
Yes. So our profession was started as preventive nurses. And so the point of a dental hygienist was to educate people about dental diseases and prevent diseases. So cleaning somebody's teeth is only part of that. We are educators, and we try to help people understand what's going on in their mouth and how to prevent both cavities and gum disease.
Wow, see, you learn something every day. I did not know that.
Yeah.
Okay, so I know you have all kinds of students from everywhere.
Yeah.
What kind of students excel at this?
So usually it's students that want to go into a health career. They like working with people. They want to help people. And maybe they don't necessarily want to be a nurse, but they want to be a health professional. So they're students that a lot of times have really liked their own dental hygienist and have had a good experience, or they've had braces and they really like a good smile. They're interested in teeth. A lot of students say that. What's
their day look like? I mean, when I go to my dentist, it seems like there's always people in and out.
Yeah.
I mean, are you doing a bunch of different things a day? Is that kind of how it works?
Yes. So usually you have a schedule and you see 8 to 10 patients a day. And you work with your own list of patients. So you have your schedule that you follow. Children, older adults. You provide x-rays, sealants on kids, do the cleanings, a lot of oral health education. We can now give local anesthesia, so sometimes the dental hygienist in an office will pop in and give the local anesthesia before the dentist starts working on a patient. Lots of infection control.
What's it like in the classroom? Like, I know it's a 2-year program, so they're taking their classes and doing this, but
Yeah.
What kind of studies kind of prepare them for dental hygiene?
So they have to have Anatomy and Physiology 1 before they start our program. And then we highly recommend that they have their other courses that are non-dental hygiene courses before that as well. And so that would be Anatomy and Physiology 2, Microbiology, COM or speech, English, Psychology, Sociology. And if a student can take those courses before they come into our program, then their focus when they're in the program can be their dental hygiene courses. And they usually will do much better in their classes if they don't have those additional classes as well.
Right. Okay, so people should know this, but maybe a lot of people don't, but your students actually work on patients here on a pretty regular basis, right?
Yes. Yes, they start working on each other the first semester or on models. And then by January of that next semester, they're seeing public patients in our clinic here. We have 17 chairs, and patients come in, they can get their teeth cleaned for $10. And they realize that the appointment is longer. It's a 3.5-hour appointment, but the students have a lot of paperwork, and there are different points in the treatment where the instructor checks what they're doing. We do full medical histories, we take blood pressures. A lot of people don't understand that we would do something like that. But our students learn that the whole body is connected to the mouth. So whatever's going on, if they're diabetic, if they have heart conditions, if they have exercise-induced asthma, all of those things affect what we're doing in their mouth.
Okay, and I've been kind of asking this question for everybody, but I know you probably see old students a lot, you go out in the community. What's it make you feel like when you see your students out there doing so well in the community?
Probably one of the best rewards you get is a student texting you or emailing you later saying, I just had my first day of work and I was so nervous, but it was awesome. And usually our students get out in jobs and they love them. And they work as good team members. We talk about that. You're part of a team, and so you have to get along with everybody. You have to go over and above. And so, yeah, the best thing is to have a student contact you and say, I just love what I'm doing.
And when they leave here, they're ready, right?
They are novice. We say they are novice, entry-level dental hygienists. We often tell our students, the next 2 years of your education is going to come out in practice when you're seeing 8 to 10 patients every day. Then you get really good at what you're doing.
Okay, we're here with Wade Hales, and he's the, Program Director of Emergency Medical Services and Fire Services too.
Fire Service Technology.
So are we talking about two things, or are there similarities to these two things?
They are two separate programs, but we've put a lot of similarities in with them. We've actually tied the programs together with a new associate degree that is paramedic associate with a basic operations firefighter.
Okay. Okay. So, what do these kids do in class? Is it more hands-on? Are they doing a lot of stuff?
It's about 50-50. There is a good lecture portion of it. A lot of the lecture currently in this state have been online. We do utilize in some of the courses a learning platform with my paramedic program. But then the rest, all of our classroom time, we associate with trying to get hands-on approach to content learned, do a lot of physical hands-on assessments, skills in airway,
sure,
IVs, etc.
What kind of kids are good at this? I mean, I know you've got a cross-section of everything, but what kind of personality do you have to be able to do this kind of work?
Actually runs the gamut. I've gotten everybody from the traditional student, college-based student that comes in just looking for some kind of hands-on career to have had several students come from the university looking for experience and getting hands-on clinical practice and having the ability to have some patient contact time that may be looking at furthering their career into doctors and physicians, to the returning learner that is a volunteer for their local fire department and is looking to give back to the community. So really the program is pretty diverse in population as far as who we see.
Well, and I'm guessing there's probably a fair amount of different jobs that you can go into after you graduate too.
Yeah, some of the students go on and they get on the local ambulance services here within the community or the surrounding communities. They may look to continue that education and become paramedics later. Then we also have students that are like continuing learners that they're actually using this time to fill in while they're going on to med school.
I know like a lot of the kids are on probably their volunteer fire departments at home that come in here. I've seen those. Is that kind of common?
Yeah, yep. And in fact, we've actually got we have a high school program that we utilize too. It's one of the things that I typically try to preach to the students, that if they're going to be staying around their homes, stay at home and come back to Parkland College to look at other coursework or do things, but give back to your community. So we see roughly about 15 to 20 of those students every spring that are actually finishing their EMT courses before they even graduate high school.
Yeah. So what kind of, if you're going into this, what kind of classes do you need besides these classes? Is there anything that helps more than anything else?
The other classes that we look at taking is medical term will never hurt. I mean, if you have the opportunity to take a medical terminology class, that always is beneficial. A basic A&P class. Our program itself is pretty self-contained, where the EMT is a single class. It is 5 credit hours, and it is 1 semester. And then at the completion of the class, then you're allowed to test for the the National Registry, which allows you to be able to move around the United States and maintain your licensure wherever you go. The paramedic class consists of 5 classes, and those start as an introduction to like A&P and pharmacology, and then goes all the way through an internship where you will ride with the ambulance to obtain a number of patient calls varying from cardiac to trauma.
Yeah. We always have to ask, what kind of pay range are we looking at? Is it kind of all over the place?
It depends. I mean, volunteer obviously is just that, as volunteer. But the average salary, and I think last time I had looked, was somewhere in between 30 to 35 starting out for an EMT. And for a paramedic, it's somewhere between, it's about 40,000 starting out per year, roughly. Obviously, the shifts run a little different, and so when you look at starting pay compared to salary, that changes because they work on a 24-hour shift schedule. So one week they may work 2 weeks for 48 hours, the next week they work 72 hours. And so they end up with a little built-in overtime.
Well, and that's something they probably better get used to in a lot of ways. Like, you got to be pretty flexible in this career. Is that correct? I mean, and no matter what it is, every day's different and every situation is different.
Oh yeah, every day and every situation is different, and that's why they call it practicing medicine and not doing medicine. They tends to today you may run 5 calls and they just kind of run the mill. And tomorrow, the next time you're on shift, you may have a cardiac call as soon as you get there on shift, and the next one's an auto accident, and then the next one's, a stroke or something, that traumatic that occurs. So,
what's it like when you look at, like, go out in the community and you see these students you've taught and things like that? How does that make you feel?
I actually get a lot of calls and returns from students. I work with a lot of them because I'm on the volunteer department in my hometown, and so I do have the ambulance service comes through, so I do get to see a lot of students or former students, and so you go to being an instructor to now we're just peers. Yeah. We're working in the system. We're working towards the same goals, and that's helping people and saving lives.
Hi, we're here with Judy Summers, and she's a full-time instructor in practical nursing. Okay, so tell me, what is practical nursing for somebody who maybe doesn't know?
Well, practical nursing is an opportunity for someone who's interested in the healthcare field to complete a program and begin working in the nursing profession in a very short amount of time. Our program is only 3 semesters long.
Okay, now you were telling me then, once you do this doesn't mean you have to just stay here. You can go on and be an RN then after this, kind of on your own schedule. Can you talk to me about that a little bit?
Sure. When someone finishes the LPN program, they can apply for the Bridge program, which is a 2-semester program where they can become an RN after those 2 semesters. Okay,
so I know you probably get all walks of people, but what kind of habits or what kind of person do you have to be to become a nurse?
To be a good nurse, of course, we're looking for things like being a nurturing person, being caring. We also look for people who are good at critical thinking skills and who maybe are a little bit more analytical.
If we're being honest about it, there may be a fair amount of stress in your job at times, and you may work some odd hours at times too. Is that correct?
That's right. Nursing definitely involves some stress and also working some odd hours. However, the reward for working as a nurse and the gratification that people receive as working as a nurse is just second to none.
Once you're a nurse, you're a nurse. I mean, I know you may have to take some accreditations, but you could take this degree and probably get a job anywhere in the country. Is that right?
That's right. It's a really versatile profession. You can get a job almost anywhere. Nurses are needed everywhere.
Okay, but locally, if you want to be a nurse, that's no problem either.
That's right. Hospitals, clinics, the jail, public health department, rehabilitation, there's all kinds of places that can use nurses.
Okay, and since you brought that up, let's talk about what kind of. I mean, when you say nurses, I think of somebody in a doctor's office, somebody in the hospital, in those two settings. But are there nurses in other places too that maybe people don't think about?
Nurses can work in other places as well. Maybe home care. Maybe they're visiting people in their homes. Maybe they're in a rehabilitation facility. Maybe an assisted living facility. So even the jail employs nurses.
Okay, so I know you do this for the love of it and everything, but it's nice to get paid too. So what kind of salaries are you looking at as a practical nurse?
That's a great question. If you look online, the average salaries for LPNs in the state of Illinois is anywhere between $42,000 and $62,000. Now that takes into account the Chicago area as well, so it might be a bit lower here, but it's still a very nice pay.
Yeah, okay, so if there was somebody that said, I want to be a nurse, I'm not sure how much time I can spend right now, or I have another job, I'm doing things, what would you tell them about the LPN program and why they should maybe take a closer look at it?
So the LPN program is a 3-semester program, and it's kind of nice because it works at a little bit of a slower pace than the RN program. So we tend to find students who are maybe a little bit older, have children, are married, have other commitments, but they're able to work the program into their lives.
Okay, and this will be your last question, and then I'll let you off the hook. When you go out in the community and you see your old students and stuff, or you go to a hospital or the doctor, are you kind of amazed at how your students have advanced?
Yes, it's an absolutely amazing feeling, actually, and I cannot go to a doctor's office without running into one of my former students. So it's a very gratifying feeling knowing that our students are successful and performing in the healthcare field.
But now we're on the second floor with Robin Hayden. And so you're in charge of the medical assistant program.
Yes, I am.
Okay, so tell me what that is if people don't know.
The medical assistant program, a medical assistant actually is a liaison between the patient and their providers. So what a medical assistant does is basically they will work in outpatient areas, including clinics and sometimes outpatient surgeries. But they're responsible for getting the patient ready for their visit. They do vitals. They draw blood, they can do EKGs, they help with surgical procedures. They also give medications, from oral medications all the way up to giving injections.
Okay, so what kind of person excels at this kind of thing? What kind of personality traits do you need?
Attention to detail. We are working with patients, sometimes they're ill patients, and we want to make sure that we do everything correctly. Another good thing to have is for somebody who is able to work with all different types of people, because we are in with a lot of different people and we need to make sure that we can work with them. Being flexible is huge, because not only may you be pulled to another department, but you may have an emergency that comes up and you're going to need to be able to adjust to the fact that that's an emergency and know what to do.
Okay, so once they get done with the program, then they become certified, I'm guessing, and then they're ready to go.
They take a national test. The national test will allow them to work anywhere in the United States.
Okay, so they're not going to have any trouble getting a job once they get done with it.
Currently in Champaign-Urbana, there's over 60 available jobs for certified medical assistants. Nationwide, they are predicting in the next 5-6 years, it'll be a 29% jump in the need for medical assistants.
Okay, and so this is a pretty good living too. I mean, you make pretty decent money.
You make pretty good money, and again, it's dependent on where you live. Of course, the metro areas, you're going to make more money, but then, the cost of living is a little higher.
Sure.
But it is a good starting point for a lot of our students who are maybe just not ready to do the RN program, but they can go from CMA to LPN and then LPN to RN, and it makes it a little easier transition for them.
Okay, so what kind of time commitment are we looking at here to take this class?
The time commitment is 3 semesters. We do a fall, a spring, and a summer semester. The summer semester is basically what they are doing is their clinical hours or their practicum, where they're getting the hands-on experience in a clinical area.
Okay, so if somebody was really interested in this program and they're still in high school and they've got, say, a year left, what kind of classes would you suggest taking to get ready for this?
Parkland College actually offers dual credit classes, and they are allowed to take one class, which is legal issues in healthcare, and the other one is medical terminology, which is a required courses for our certified medical assistant program. So if they could do that, that would be less that they would have to do going in as a freshman.
Okay, now we're here with Tamela Everett. She's the program director of massage therapy. Hi, Tamela.
Hi, how you doing?
Hi, I'm doing great. Okay, so just let's do the basic stuff first off. Tell me about the massage therapy program at Parkland College.
Okay, our massage therapy program, it's actually been in existence now this is our 19th year.
Oh, yeah.
Yeah, we've been putting out really skilled licensed massage therapists. And this program is designed to train a person to deliver a Swedish massage, and we can get that done in 3 semesters. So students, they do a lot of anatomy. They have to, really understand how the muscles work in order to give the best massage. And it's based in a lot of hands-on work. So we're doing a lot of hands-on work so they can get skilled and master Swedish techniques. So when they get done, they're ready to get out, be hired, or even work for themselves.
Okay, so 3 semesters and you're ready to start. What kind of pay scale are we talking about when they begin?
Well, that's really interesting that you say. We have people that get out if they work for other people. Right now the going rate for a massage is around 80, when you're independently working like $80 an hour. Some people decide to charge 60. So that's $1 a minute or more. And people are really booking and doing well with that. Now, if you decide to work for a spa or in a chiropractor's office, those prices can definitely range. You decide if you want to do 50% of the massage, and some people are even renting spaces. But there's a lot of benefit to working in those spaces as well, because your clients are there, and there's some definitely pros for all of that. So
yeah.
Yes.
Okay, so if you decide to work for yourself, and I'm guessing even at spas and stuff, you can maybe plan your schedule a little more in this career than some other ones, right?
Oh my gosh, yes, it's very flexible. You can decide to do a couple massages a day. It fits, I feel like it really plays nicely with other fields. There have been a lot of people that are already nurses that decide to do massage. So there are people that have a full-time job to do it on the side. You can make enough money that you can decide just to do it part-time and still be doing fine. So it's 1 year, there was this study that said massage is so great because people can get full-time pay for part-time work. And so it's quite flexible for if you have families or you just have a busy lifestyle. And who doesn't want to know a skill that can bless so many people, right?
Absolutely. Well, and in 3 semesters too.
Exactly.
If somebody's taking this class, is there something that you can take in high school or before they come to class that would really help them, or do they have to take things before they get in?
Well, we have, if a person wants to get in the program, they just have to be ready to sit for English 101, okay? So, but if you like anatomy, and if you've had some anatomy in high school, that's just gonna make it a little bit easier, since it's really based on a lot of anatomy. I've noticed that students that have a knack for that will, they catch it a little bit easier. They're like, oh, I understand this more. But even if you don't have that background, we're prepared to help you get that.
Okay, so let's talk about the program itself. When they get in there, I've seen some classes before. You guys don't mess around. You're doing stuff, right?
Yes, we are. We're definitely hands-on. Literally, the first day of class, we're right in hands-on. Even in orientation, I want them to be comfortable with being able to touch a person and getting those hand skills down. If a person is nervous or not confident in their hand skills, a person's gonna feel that on the table. So the more practice, the better. And they do around 200 hours of massage before they graduate. So we really have them doing a lot of work.
What kind of students do you find really excel at this? Is it all kinds, or is certain types better than others?
Yeah, it's a big range. What really is exciting is we'll have people that come straight out of high school, which is wonderful because they start their career earlier and they can do it for longer. But I see just as many people that come back as a second career, and even that like have another career that they're just deciding to add on. So it's different age ranges. We've had different people that already started their career have come back. So different types. I'd be surprised. Some years I might have a lawyer and a nurse in the same class, people that do sports. It's interesting how much it just appeals to so many different people. Yeah.
Okay, so one thing, and we're not discouraging them from the massage therapy program, but it's physical all day long, right?
It is physical.
Especially if you're doing that all day long. Can you talk about that?
Oh yeah, I'm glad you said that, because something we do at Parkland is we really focus on delivering a massage with appropriate body mechanics. Because what can really tire a person and cause you to say, wow, what am I thinking here? Or maybe I would rather be on the table than my client, is if you're delivering a massage and your body mechanics are all off. So we really train the students right on that if you find that you're in the middle of a massage and you feel something that's uncomfortable, you switch immediately. We don't work through pain. You want to do the best quality massage, but you want to do it in a way that is beneficial to you as well.
Okay, so you said the program, I know you haven't been here 19 years, probably, but the program has. But tell us a little bit when you go in the community or you talk to spas and everything, just about how your students are like taking into the community. That's going to make you feel really proud.
Oh, I'm so proud of the response we get from all of the people in the community, because our graduates do not have any hard times getting jobs. At all times, there are people that are interested in hiring them, like literally as early as today. I'm still I've been talking with people constantly at all times, hey, send us more people. And they like that when they get out, they're ready to roll. They don't have to train them extra because they get out ready to start.
Okay, so when should people apply for the program?
Okay, well, the priority deadline is March 1st. So next year, priority. But we still accept people beyond that because we have a day and a night program. And if people are interested in one or the other, it'd be great for both of them to have that option. So it goes by numbers. So if you're interested, I would start applying. I'm starting to actually get a couple of applications now for the day and the night. And so once you get that application process done, we can see if you make it, and we'll start knowing the numbers we have that would start for the next fall. So we accept people once a year. So it's really important that you get the application in on time so you don't miss your opportunity.
Do people go on from massage therapy at Parkland to go to four-year schools or do advanced degrees like that?
Oh man, that's a great question. Yes, something I didn't say was that you can get a certificate or you can get an associate's. So we have a program for both. And the beauty of the certificate is that you get out, you study for the MBLEX, you pass the MBLEX, our pass rate's really awesome, and then you can get your state license and begin working, okay? But what makes the associates a little bit different is that there are more core classes that you would take, like an extra semester, and then those classes will help you get your complete degree. So you can graduate with a degree instead of a certificate. So you'd have both the certificate and the degree. And the beautiful thing about an associate's is that it builds. It's like a Lego block. It's gonna build, and now you can take that and make sure that you can take that into getting your bachelor's.
I know you might have to take a different state exam, but is this pretty transferable across if you move or anything like that?
Oh, yeah, that's a good question. So one thing about massage that's different than some things is this different states regulate it. And so since the different states regulate it, that means a person could graduate from Parkland and decide, hey, I want to go to Florida because, it's sunny there. They're going to look at how many hours our program is, and our program is 817 hours of coursework. Now, the one thing I tell people is do not leave the state without your license in hand, okay? Mm-hmm. So I would get the certificate, and then I would study for the MBLEX, pass the MBLEX, go through the process of getting your state license. So if you decide, hey, I'm gonna live in Tennessee, then you can transfer that license to Tennessee. And there's not a state that has a higher number of hours than we do.
Okay, we're here with Deb Bucher. She's an associate professor of nursing at Parkland College. Okay, tell me about where the other version was the LPN program, and which version are you now?
Yes, I teach in the RN program, and the students will receive their RN degree with the associate's degree in nursing when they do graduate from the Parkland College nursing program. And they do have an option of either going 2 years. Students can come straight out of high school and go 2 years straight and have their RN in just that short amount of time. Or what a lot of people do, I'd say the majority of students will take their prerequisite courses prior to entering into the nursing program to make their lives a little bit more manageable. And then that way all they really need to focus on then after the first year of getting their prerequisites out of the way is just focusing totally on the RN nursing program. So all their classes will be devoted to nursing then. So.
Okay, when they start this, I know there's a lot of simulation labs. Kind of tell me what their day's coursework is like when they're here.
Yeah. So some classes, we do a variety of different things to help teach the students how to become nurses. And of course, the one part is the theory, the lecture part, where the students will meet. Usually, it's once a week. The students will meet in a class, and they will have a lecture. Some people, depending on what nursing class that they're taking, will be in a nursing lab, and this is the nursing lab that we have here. We have another one, and then we also have another lab, which is H-Wing, this just is off of Mattis, that here they're working with mannequins, and we call this low fidelity simulation. But at H-Wing, they actually get to go and take care of mannequins who can do pretty much anything that we want them to do. They can, we can talk for them. They can listen to their heart. They can listen to their bowel sounds. They can feel for pulses, and that's really that's a really good way to learn. They're really diving in and helping to take care of that patient. And we always tell them, try to think of yourself that you're in the patient's room at the hospital, and you're giving care to this patient. And it's just another different way of learning. But it's a really good way of learning too, though, because if a student would maybe make a mistake or come close to making a mistake, that's like a really good learning opportunity for everyone involved. They didn't cause harm because we're in the simulation lab, but yet they can take that mistake and they can turn that around. And then also when they go to the clinical and taking care of real patients, then they will not make that same error or same mistake. So simulation is a great place to learn.
Yeah, and I've been in the simulation labs. Sometimes it kind of feels like it's real, and I'm sure it does to the students too, because there's a voice talking out of a patient, and you give them problems, and you can be a difficult patient sometimes.
Oh yeah, we do have some difficult patients, which is really cool because the students learn how to manage those type of patients, and something else too, that when they're in simulation, they also can practice and hone in and make better their critical thinking skills, because as a nurse, you're always thinking about what maybe is the next thing that's going to happen. And I always tell my students, you always want to expect the unexpected because it will definitely happen. But nursing is just a really great field to go into, because if you're want to help take care of patients and you're a service-oriented people person, then nursing is a great area for you to go into.
Okay, like in the life of a nurse, you don't know what's coming next. You may not know which hours you're working next week.
Yeah,
Can you kind of talk about that?
Yeah, that's right. Yeah, so depending on where you're working, some areas have your schedule set for a month, and then other areas, they may not even know whether they're really maybe even working that next day, depending on the numbers of patients that are coming through, to have different procedures done, that sort of thing. So yeah, so some of it's very set and some of it's not very set. So nurses have to be really flexible when they're going about and doing their different tasks. And yeah, you can have you can get to report on your patients if you're working in the hospital and you think it's going to go A, B, C, D. First patient you walk into, there's an issue, and it just kind of turns your day all the way around, and you just have to change your focus, and you've got to be able to act, quickly and on your feet. And again, that's where your critical thinking skills really come into play, because things can change so quickly, when you're taking care of a real live patient.
When people think nurses, they may just think hospitals, but you place nurses in a lot of different places, correct?
Oh yeah. That's the great thing about being a nurse, is there's so many different areas. So hospital nursing that I've talked about, nurses can work in a clinic, nurses can be a forensic nurse, nurses can do travel nursing, nurses can work in prisons or jails. You can work for insurance companies. You can be a nurse consultant. You can start your own business as a nurse. Maybe doing home care. So there's home care. There's hospice. So there's just endless opportunities, for nurses. You can teach like I do. I teach here at Parkland, but I also work in home care as well. So yes, that's the really nice thing about nursing, is if you get tired of one area that you're doing, there's 60 other different areas that you can go into. So it's very challenging. Being a nurse is very challenging, but I would say it's extremely rewarding. And I know as a nurse in my nursing career, I know I've helped out a lot of people, but I have received so much more back from patients that you just can't even imagine.
Awesome. And then another really good thing about this, your starting salary is pretty good.
Oh yeah, starting salary is I would say very good. So I'd say starting salary in the area is probably anywhere from maybe $24 to $26 an hour. $50,000, $60,000 a year. And most places you can, if you stay someplace very long, you can really build yourself up, and it's not a bad career. You can do pretty well for yourself as a nurse.
And I'm guessing this is like every other health profession program at Parkland, but you have a real good job placement rate and everything.
Oh yeah. I would say most of our students that we have here at Parkland do go on and stay here in the community. The community has supported and loves, our Parkland nursing graduates. I would say job placement is 100%. And like I said, not everybody will stay here, but everybody can find a job someplace. And again, certainly with the pandemic, we really are seeing an increase in the need for more nurses. So it's never a problem to get a job, whether it's here or in another state. There's just so many different places and so many opportunities, for these students to be able to find jobs. So yeah, so it's really easy to get a job in nursing.
Do many students move on after they get done with nursing here and go to four-year school? Or
Yeah. I would say probably, I don't know what the percent is, but I would say upwards of 95%, if not more, will go on and get their bachelor's degree. And what's really nice is you can go to Parkland and get your RN degree in 2 years or 3 years, and then you can go work at a hospital, say Carl or OSF in Urbana, but you can go work there, and that institution will help pay for your education to get your bachelor's degree. And actually, if you want to go on and get your master's degree, the facilities will also pay for you to go on and get your master's degree as well.
When you go out and you see your students in the field or you run into students,
oh yeah,
what's that like to know how well they've done?
Oh man, I tell you what, I am just so proud of our nursing students, and it's just an honor it really is an honor to watch them and to see them as students here, and then to go on and see them actually working as nurses in the hospital, and actually taking care of some of your own family members. And it's just such a good feeling to see them doing so well and being so successful as a nurse, and see them enjoying it and thriving and growing. It's just it's almost hard to put into words how I feel, and how we feel as a faculty when we see our students out there working as nurses. They just do an excellent job, and it's just really heartwarming to see them doing so well.
Okay, now we're over at Parkland on Madison, what we call the H building. We're talking to Program Director Michelle Roberts of the Occupational Therapy Assistance Program, correct?
Yes.
Okay, tell me a little bit about your program. What is it? If somebody doesn't know about it, what is it?
What is it? Occupational therapy works in many different settings, where we work with people who might have an injury or disease process and they can't do things they like to do on a daily basis.
Is this rehab, or is this people that work that have been like this for a while, or what kind of, is it everything?
Great question. Definitely rehab. We do have a lot of rehab qualities, but we also work with people with chronic conditions, work with people who have maybe just need some extra help or strategies to live on their own.
Again, some of the students are going to show us some examples pretty soon, but can you just kind of give me an overview about what kind of, like a few examples of what you might do that people might not think of maybe?
Okay, yeah. One thing that we probably won't get to show today is that we do make splints for people. We use a thermoplast material, and we mold it to somebody's hand, and that allows them to protect those joints or give them some support when they're healing.
Like, what kind of time period are we looking at to be an OTA?
Sure. It's a 2-year program, and the application is always due by March. And we do use the selective admissions process to accept students. There is one prerequisite, and that's the Kinesiology 186, which is Intro to Human Movement.
Okay, now can they take that during the first semester, or they need to have that before they apply?
They have to have it before they get into the program.
Okay, and what kind of, I know most the health profession programs, you can get a job pretty much as soon as you get done. Is occupational therapy the same way?
Yeah, there is a good job market. We are, like, if you look on the U.S. News, we are listed as a bright outlook for OT and OT assistants. And so, yeah, So we can work in lots of different areas, and you'll hear a little bit more about those areas.
And what if, I know a lot of kids will stay here, but some might want to go somewhere else. What does it look like nationwide?
Yeah, a really great outlook nationwide as well. We probably I get a lot of emails regarding opportunities throughout the country.
Yeah, is there just a standardized test you take and then you can go anywhere? How does that work?
It's a national board test that they take once they graduate from the program and they finish their field work, and then they get to take this boards test.
Okay, thanks, Michelle. We're going to do this a little different. We're going to talk to some students about their experience and then talk to Mike Weaver at the end to kind of wrap it all up.
Hi, my name is Becca Warner, and I'm a first-year student in the OTA program. The reason I joined this program is because I've always had an interest in healthcare. It's something that when I went to college the first time, I was interested in EMS, and I had a question in my mind: what happens to people after I brought them to the hospital? Like, how did they go through the healing process? And fast forward quite a few years in a family, and I just kept coming back to that interest. That strong interest is what pulled me back into this program. And I love the OTA program because of the challenges that you face, the problem solving, and the classroom looks like real life. So right here is mostly our pediatric classroom. We have stations that can help kids with balance issues that they might have, like vestibular issues. We have bouncy balls, basically all the toys. So there's some bouncy balls, things like this we can use for strength training. So there's just a wide variety of therapeutic activities that we get to learn about, and we get to do it right here. And hopefully when I leave this program, I will feel confident doing this in the real world.
Hi, my name is Allie. This is my first year in the Occupational Therapy Assistant program here at Parkland. Something that drew me to this program is that it seems really more meaningful type of therapy than like physical therapy, because that's originally what I was planning on doing. In occupational therapy, we use a lot of meaningful activities, things people will do in their daily life. Like this lock board, it has all these different things on it that people use in their daily life, and we would use this in therapy. A few other things we've learned so far are goniometry, which you use this to measure like range of motion in your joints. And that's kind of like the baseline for things, because if you don't have functional range of motion, you really can't do much else. We've learned strength testing, grip strength, pinch strength, manual muscle testing, and I really look forward to the rest of the semester and the rest of this year and all the other things we're going to learn.
Hello, my name is Elaine Barnett, and I'm a first-year student at OTA at Parkland. A reason why I picked OTA was because my grandparents had to go through OTA and PT, and I really just wanted to help the older community and the younger community, and just help people in general, so that's why I picked OTA. Briefly about this room, this is our lab room, and everything works in here, the stove, the kitchen area, everything. So what we do in here is demonstrate problems or scenarios that people struggle with, and we help them get back to those areas that they enjoy doing. Some jobs that we can find OTA at is hospitals, nursing homes, mental health, and just rehabilitation areas.
Hi, my name is Monasia Harris, and I'm here to talk about a little bit about how I got into the OTA program. So I knew I wanted to be in the medical field, so I was taking all these classes that kind of had to do with it, and I stumbled upon Intro to Kinesiology, and that's where I got introduced to careers that I could choose with a kinesiology degree. And I did my presentation on OTA, and come to find out they had an OTA program at Parkland, so that's what I wanted to pursue. So I took all my co-recs in order to get into the program, and I applied. Fast forward, here I am, first year in the OTA program.
Okay, we're back to finishing up with Mike Weaver, an instructor in the program. So we met some of the students. They all seem great and really into it. What kind of qualities do you find really is good for students in this area?
Students who are committed and caring, definitely creative. It's a very creative profession. We do a lot of making things, building things, and through that help our clients to work on whatever functions, activities that they need to work on to improve their health.
And I'm guessing probably every client is different. Like you're going to have to adjust as you go along, right?
That's true. There's a lot of problem solving, as you heard before, And every client is different, and we try to make it meaningful to that client. If a particular client is into crafts, we will, instead of just having them do exercises, we will have them work on crafts that will help rehabilitate their arm or whatever physical condition they have.
Okay, and I know people, this is hospital, this is going to houses, this is, you might work everywhere, right?
Right, you heard some of them earlier, but yes, hospitals, we work with kids in schools. We also home health, as you mentioned, nursing homes.
Okay, so let's talk about a little bit about the field work that your students may do.
The first year we do what we call service learning, where they volunteer at different facilities and different programs around the community to kind of get them working with people of different backgrounds and kind of helping the community out. And then they start going into field work where we actually send them to clinics, outpatient clinics, hospitals, schools, all those places I mentioned before.
Okay, and we've been kind of finishing up with this question, but I know you're probably out in the community a lot, you see your students, you talk to your students. What's it make you feel like when you see students who've been through the program that are doing living their dream and being successful?
It makes me proud. We have a good reputation with this program. A lot of people say that their Parkland graduates are some of their best employees.
Now we're back downstairs with Midge Same, and we're going to talk about respiratory therapy. Okay, kind of tell me what respiratory therapy is, if someone doesn't know.
A respiratory therapist is a specialty healthcare provider. We take care of patients who, for whatever reason, are having difficulty breathing. Sometimes it's an acute illness, an acute injury, like a gunshot wound or a knifing or an automobile accident. It could be an illness like a pneumonia that causes somebody to have difficulty breathing. It might be somebody who has chronic lung disease, emphysema, chronic bronchitis, asthma.
Okay, now are these people, once they graduate, are they working out of a hospital mostly?
About 85% of the therapists today will work in a hospital. Other opportunities for a respiratory therapist are in home health for those patients who have chronic illness. So sometimes respiratory therapists are recruited to do medical sales. It's easier to sell respiratory equipment to a respiratory therapist if you have some understanding.
So then 5 semesters and they're done with the program and ready to work.
2 years, 5 semesters. We start in the fall, go straight through until 5 semesters later, graduate in May. We tell our students to consider their clinical rotations the longest performance-based interview they will ever have, and most of them will graduate with job offers.
Okay, so you kind of mentioned it, but job placement-wise, are they going to have trouble finding jobs after this, or?
Nationwide, there is a respiratory therapist shortage. Here in the Champaign-Urbana area, there's always an opening. One of our hospitals pretty routinely has agency temporary help in-house just because of the growth for the respiratory therapist in the area. It's a national credential, state licensure. So if somebody wanted to move to another state, that credential would go with them. They would just have to apply for a license in that other state.
Okay, we're here with Janice Grewatts now. And in the health professions, it's amazing to me, but you guys have about 100% job placement.
That is correct, and that is the surgical technology program here at Parkland College. All of our graduates that have sought employment over the past 7-8 years have obtained employment even before they graduate. There is a high demand for surgical technologists not only in the central Illinois area, but nationally as well.
That's amazing. So tell me what kind of stuff do you do? I mean, you guys are moving. You don't sit around, right?
No, we are very active. So we are in one of those professions where you're on your feet all the time. We work strictly in the operating room in the surgery department. So we are the ones that are organizing everything to prepare for a surgical procedure for a doctor. We hand all of the instruments, supplies, and equipment to the surgeon. We make sure that everything is accounted for and we're not leaving anything in the patient, and that we're anticipating what the doctor needs.
So I'm assuming this is one of those programs where you get a little lecture, learn about it, and then you're out there actually doing it.
Right. Our program consists of both lecture, lab, and a clinical component of the program. So we do a lecture, which kind of goes through all the theory of the program, of this profession, and what the job duties are of a surgical technologist. And then we practice all of the skills in the lab. And then after 8 weeks in the lab, we send you to clinical, where you actually have hands-on experience in real surgical procedures at local area hospitals on patients.
And healthcare is not going away anytime soon either, right?
You never hear of a surgical technologist being laid off. So we are in demand, and there is plentiful job opportunities.
Okay, we're here in the Vet Tech Lab with Laura Suter. Hello, how are you? And a special guest, I guess, today.
Yeah, this is Maple.
What's her name?
Maple.
Maple, okay,
Yep.
very good.
She's one of our program cats this year.
Very good. So you're the veterinarian for all the animals, and you also work here, I guess.
Mm-hmm. Yep, so I teach a couple of classes, and then I oversee the care of the animals, so their veterinary care.
Okay, so tell me a little bit about Parkland's program. It's a 2-year program.
Mm-hmm.
All kinds of animals, mostly small animals. What kind of animals do you work with?
Yeah, so here on the Parkland campus, we do have cats and dogs that live on campus. They are here for 1 academic year, and then we actually adopt them out. Most of them go home with our students and staff here at Parkland. Most of them come from animal shelters. We utilize them for our teaching program, and then they get adopted out.
So the vet techs, they're working with actual animals quite a bit then?
Yep, they're working with cats and dogs on a weekly basis. We do work with the University of Illinois for large animal programs, so they go over there, they work with cows, horses. They do get to rotate through a little bit of even exotic animals over there.
Wow. So what kind of students do you find are good at this, that make good vet techs? What kind of personality do you have to have?
So you need to be good with animals, obviously.
Right.
That's going to be the first thing, is a love for animals. But you also, a part that isn't really known as much, is you also have to be good at communicating with people, because attached to every animal is their owner.
Right.
So good at animal skills, people skills, and then hands-on. It's a very hands-on profession.
Okay, so here at Parkland, it's a 2-year program. Do people get hired pretty quickly once they graduate from this program?
Yep. We have a very good rate of getting hired after. So they do their 2-year program, and then the following summer or fall, they then will sit for their board exam. So the VTNE is what their board exam is called, and then they become what's called a certified veterinary technician, or a CVT.
Okay, and then I know probably a lot of them just do that and that's what they want to do, but do a lot of kids move on and go to 4-year school and take things after this?
Not as much with our program. It is more of a career program, so we do have students who have gone on to further their career. There are some who have gone out, been veterinary technicians for a few years, and have actually gone back to veterinary school to be a veterinarian, but that's not really the main focus.
What kind of pay do vet techs look at?
Starting is going to be in Illinois somewhere around probably $15 to $17 an hour. It's going to vary more if you're in a rural area. It's going to be maybe a little less. If you're in an urban area, it's going to be more. You
got to be ready for anything if you're doing this. Every day is probably completely different when you're working out in the field, right?
Oh yeah. Yep, any day, one day you could be seeing appointments, so helping the veterinarian, drawing blood, running lab work, just taking care of the animals in general. You could be helping with surgery, so veterinary technicians are a large part of the surgical team doing anesthesia. So they're putting the animals under anesthesia, and then any of the pre-op and post-op care generally falls with the veterinary technician as well. So giving medications, any sort of nursing care, they're just a very important part of the animal care team. So they work usually directly with the veterinarians, and any sort of kind of the nursing care kind of falls to them.
So like when you do this, you might think, oh, the local veterinarian and stuff, but do vet techs do a lot of things besides just veterinarian offices and stuff? Yeah,
they can. They can do research, they can work in laboratories, like some of the big biomedical labs will hire veterinary technicians. They can go work at zoos.
Okay.
So yeah, there's a whole bunch of different career options.
And when you go out, like when you go out in the public and you just see your students and you see them working, how does that make you feel? I mean, is it pretty cool that you know you've trained them and you've trained them really well?
Yeah, it is really cool. There's not too many of these programs. I believe there's 3 in the state of Illinois currently, so it's not a very common program. We only accept 32 students every year. So yeah, it is really cool to see them out working. A lot of them do seem to stay local, which is really cool.
Okay, well, if it seems a little dark in here, that's because we're in an x-ray lab and we're gonna talk, you know what, I'll just show you. I had to write it down because I knew I wouldn't say it right. Radiologic technology, and we're talking to Tammy Cox, and you're the program director, is that correct?
That is correct, yep.
Okay, so tell me a little bit about this. I mean, everybody knows what an x-ray is, they think, but tell me a little bit about what students do in this area.
So students will learn anatomy and positioning on patients, and we learn that out here at Parkland first, and then we practice on each other. We actually don't take x-rays on each other, but we do a form of simulation where we get all the way up to the point of positioning the patient prior to taking an exposure, and then we don't take the exposure.
Sure. Tell me about what kind of, like this, I assume there's a lot of different elements involved in x-ray technology. What kind of classes would you take before you start focusing on this?
Well, pretty much every course that's in our degree can be taken at the same time that you take x-ray courses. But if you're waiting to get into the program or want to kind of jump ahead and take some courses prior to getting admitted, some of those courses might be Anatomy and Physiology 1 and 2, a communication course. Interpersonal communications is a really good course to take, and medical terminology. Okay,
what kind of students excel at this? Is there a certain personality trait? I mean, I guess patience is probably one, but what kind of students do you find do really well at this kind of work?
Students that do really well are students that are great communicators, people that can talk to the patient, get a good history, and get the patient to go into a position that we need them to do. Students that are detail-oriented are very good and excel very well. And also students that have the ability to think outside the box, because we do a lot of critical thinking in radiology.
Yeah, kind of tell me about that. What kind of things, when they're doing their job, what kind of things will they be doing that they have to do all these things together?
So critical thinking, if you have a patient that comes in and they have a broken bone or they have something that's dislocated, they might not necessarily be able to get into the position that we need them to do based on limited range of motion. So if they have an open fracture, they're not going to be able to move the limb like someone who just has pain. So we have to do certain things to be able to get the same types of images for the radiologist to read to get a diagnosis. But we might have to do what we call a shoot through, which is where we don't move the patient, we move the x-ray tube and our detector around the patient because the patient has that limited range of motion.
Okay, so when you're doing this, I know it's probably all over the course, but what would a typical day be like for somebody who does this?
Every day is going to be different, and it depends on where you do your clinical sites. So we do a combination of both hospital sites, which would be more inpatients, people that are in hospital rooms, trauma situations, and then we also send our students through clinical situations where it's more of like an outpatient setting. Patients may be gone to the doctor, they requested an x-ray, patient walks in, gets her x-ray, and then leaves for the day. So you're going to see a variety of different things based on whether you're inpatient or outpatient.
Right. What kind of schooling are they looking at? Is this a 2-year program or is it?
Yes, it is a 2-year program. You do graduate with an associate's degree in applied science in radiologic technology.
Okay, once they get through with the 2-year program, is this the kind of thing where they can continue their education?
Yes, absolutely. We actually promote continuing education in radiology. There are several different advanced modalities that you could go into. There's CT, which is computed tomography, MRI, sonography, radiation therapy. Those are just a short list of advanced modalities that you can go into. Our program has CT courses built into it, so a lot of our students do further their education in CT. CT and diagnostic imaging go hand in hand. So if you have a patient that's in a trauma, they're going to go through CT, and it's nice if you have the ability to be able to do both of those.
Sure, and what everybody wants to know, I'm assuming this is a fairly great job to have payment-wise.
Yes.
So the national average for radiologic technology starts at about 59,000. So that's the national average. If you have an advanced modality like CT, MRI, sonography, that's just going to add to your base pay.
And probably no trouble getting a job, I'm guessing.
Absolutely. We have 100% job placement. We've had 100% job placement since 2012. Right now, we have students in all sorts of settings, outpatient, inpatient.
Okay, and so obviously you can get a job around here. If you decide you want to move to another state, I'm sure you may have to license again, but you can still get a job pretty much anywhere in this country.
Absolutely. So once you're done with our program, you will sit for a national certification exam, and it's a 200-question test, but it is a national test. So you can take the test, and you could potentially work in any of the 50 states in the United States.
Okay, and last question, when you go out into the public or you go to the doctor's office or when you see your students, how do you feel about them? I mean, are you proud that, like, man, we have so many students doing this? This is a great feeling.
Absolutely. We have a really good reputation with our students being well prepared right after graduation. So as soon as they graduate, they know what they're doing, they know how to perform the exam, and they do it well. So it does make me very proud.